This is going to be a quick video on how to complete a ePCR in our FirstDue system. So when you log in, you come up here to the FirstDue icon and scroll down to Incident Documentation, and then you'll see EMS Incident List. Go ahead and click on that. And this is not like ERS where your call will be populated on here and then you go into it. You have to come over here to Add New, and then you create a PCR for yourself here. And then when we have the CAD communicating with FirstDue, hopefully shortly, you'll go here to download CAD, and all that information will be able to pull into there. So all of your dates and times and all that stuff will be on here. However, right now, we're going to have to manually do this. So captains, acting captains, paramedics will have access to another website, VisiNet, and we'll have to manually grab that data and put it in here ourselves. So these other buttons that are up here, we don't really mess with. The rapid intervention is a tool that we can use on scene with the iPads or your phones if you have the app downloaded. The monitor button is for our monitors that will be connected. They're not connected currently. That should be done very shortly though. Over here is the active part of the PCR. This is where you cruise down these tabs to answer all the different questions that you need. And then you can select these within those tabs to go to the different ones, or you can just scroll. So this first one here, you'll notice it's a red field, and what that means is that correlates to these numbers that are over here. That means that it's an error validation code, and it has to be completed before you can actually complete the run. So these are mandatory reported items that you will not be able to complete your run until all the red numbers are gone. We also have yellow numbers, and those are recommended questions for you. So if you have the information, you can put it in there. If you don't, you can still complete the run without it. It'll just ask you before you complete it, like, are you sure you want to do this? And then you can say yes if you don't have the information. So just cruise on through answering questions. This first one kind of runs the rest of the report, like whether you had patient contact or not. You can see that it changes how many questions you'll be answering. So we'll say yes. And I'm not going to go through every single question for the sake of time. I'll try to hit the ones that are really important though, like this one right here, transport disposition. These first two are for like Evans Ambulance if they're going to be using our system. From here down is what we will select, because the first two give you a lot of transport questions, and so we don't want any of that. So we'll select that, and then you just cruise down and you just answer the questions that it's asking. Hospital team activation is something that we're not using right now, maybe in the future. Narrative, you just type your narrative in there, and this is your PCR narrative, not the captain's narrative. And then when you're done with that, just cruise to the next tab. Crew member, you just select here, and then you can type in their names to find everybody. So everybody will be added there. Dispatch reason, this is one of those mandatory reported things. Almost all of the red mandatory reported things are the required stuff for NERIS or NMSIS. There are a few that the department wanted so that we can make sure we're collecting good data, but most of them are things that we can't change. Time is what I was saying before with the download CAD. That's how those will come in here once we do that, but right now we're going to have to manually input those from VisiNet. So just keep cruising down. The event number and incident number, this is something that they're still working on, exactly how that's going to work, but event number will be auto-populated from the CAD when that happens, and the incident number you'll just copy. But for right now, you just manually input that. There will be more to come on that, I think. And then you just cruise down. This vehicle unit number and unit call sign, this is something that has to be brought in manually. So when the CAD is working, this will just work. For right now, dispatch is going to have to create a call in here, and then it'll be able to be pulled over. Shift, you can just leave that blank for right now. There's more to come on that as well. Station is your station, and then any delays, you can put those in there. How you responded, and then apparatus, You'll notice that 1911 is not in here. And that's because 1911 currently is out of service. So when a vehicle is out of service, there's something in the background that has to be done in order for it to show up on this screen. So if your apparatus is not on here, you just need to let your captain or battalion chief know so they can go in behind the scene to make sure that that apparatus is associated with the apparatus that you need it to for your PCR. Scene, you just go through and answer all the questions. This address stuff here is for the address that the scene for where your medical is. Responder is any EMS agency that responds with you. So you're done with that. Keep cruising down. Patient name, all that stuff goes in here. The male-female question will give you pregnancy-related stuff if you select female. And then just keep cruising down. This is the information. If you have it, you put it in. Patient's home address. Employer, so like this stuff, if you have it, good. If not, you can just collapse it. Same thing for guardian. If that's information that you have, you can put it in, but if not, just collapse. Emergency contact, same thing. And then the EMS section, just answer your questions. And here, I wanted to note that you'll notice for medication allergies, if they don't have an allergy or no known allergy, it's not on the list. And so it couldn't be added, so we had to put it over here. So you're just going to click this button here, and it'll be no known drug allergy for that question. These lists are pretty comprehensive, and they're in alphabetical order. And then just keep answering questions. For kilos and pounds, whatever it is, you can put it in and it automatically fixes the other one. Current medications, now this is a validation, it's a yellow one, because we want to make sure that you're answering this if you have this information. If they do not have any meds, then you can just put none reported. Immunizations we don't mess with, same thing with that, or insurance. So go to the next one, assessment. Now this question for yes or no will determine if you answer some trauma related questions. So if you put no, you don't get them. If you put yes because you're on a trauma or on an injury call, then that'll give you those. Just keep cruising down, answering your questions. Chief complaint, you just type that in there. And then some more times, locations of the injury, acuity level, symptoms, all that stuff is in there. Your assessment, you just hit add here. If you have a normal assessment where everything was okay, then you can put no abnormalities. If you wanted to correct something, you can just go in and change that, whatever it is. So you can just go in here, and it's very in-depth, so you can see that for yourself and figure that all out. Cardiac arrest, if it's no, then it takes away all the required reporting that's in there. You just keep cruising. As I was saying with the injury, with the trauma related questions, if you selected yes for injury, then you get a cause and trauma criteria and all this stuff, so you just answer those. Vehicle impact locations, airbags or not, height of fall, stuff like that. So we'll just keep cruising. Vital signs, you type in whoever did them or find them on the list, and you just go on down and type in all the vitals that you have. And when we have the devices loaded, they will automatically come into this. So you'll be able to have all your vitals populate into there. Lab imaging we don't mess with, and then devices is what I was saying earlier. Treatments, protocols, we don't have anything yet. More to come on that. Procedures. The first few, so the first like 10 or 15 or so are ones that we go on, are ones that we use mainly. If you have something else in here, then you can just type in and it'll search for you. Or after those first 10 or 15, it's alphabetical order. So you can go down and select those. And just like ERS, we need at least 2 of those procedures in there for that. Medications are medications that we give. So this is mandatory because we want to make sure that everybody's answering this question. So we have all of our meds in there. If you did not give any meds, then it's not applicable. Airway, if you did airway, used airway, there you go. Billing outcomes, we will not be using this. Attachments is for our refusals and EKG, stuff like that for right now. Once the monitors are connected, we'll be good to go. Like that stuff will download unless you have one of the older monitors, which there are like 1 or 2 still out there. Those ones will still have to take pictures or scan PDF kind of thing and download that stuff in there. Our refusals will go here. And then that's pretty much it. And then you get to signature and you have to make sure that all these red numbers are all gone. You get to signature, you just hit edit here and you type in who's signing. Timestamp it, and then you can just sign. And then when you're all done, you'll go here and you'll hit complete. And what it'll do is it'll run a validation check, and then if there's anything on here, it'll pop up red again to tell you like, oops, you forgot this, or it'll pop up yellow. And so you just go in and you correct those, and then you can go back and complete it. And then if there's any red numbers, you won't be able to finish it. If it's yellow numbers, it'll give you another prompt to say, are you sure you want to do this, even though you have these yellow numbers? And then you just hit yes. And that is how the PCR is completed in FirstDue.